Hi everyone, welcome back to my YouTube channel, and today we are going to talk about pathway of hypoglossal nerve. So let's start our topic with introduction. Hypoglossal nerve is the 12th cranial nerve that is responsible for motor innervation of all intrinsic and extrinsic muscles of tongue, except for the palatoglossus that is supplied by vagus nerve. It plays an essential role in speech, swallowing, and tongue movements. Hypoglossal nerve is purely motor nerve and has one of the most straightforward cranial nerve pathways, though with clinically important anatomical relations. Origin of hypoglossal nerve. It has nucleus that are located. The hypoglossal nerve fiber arises from hypoglossal nucleus, that is a collection of motor neuron that is located in the medulla oblongata near the midline beneath the floor of fourth ventricle. Hypoglossal nucleus receives bilateral corticobulbar tract input for voluntary control of tongue movements. Emergence from the brainstem. When it emerged from the brainstem, the nerve rootlets emerged from the posterior lateral sulcus of the medulla between the pyramids and olive. About 10 to 15 rootlets converge to form the main trunk of the hypoglossal nerve. Course of hypoglossal nerve. It has intracranial course that starts when the rootlets join and form the nerve trunk in the posterior cranial fossa. The nerve then travels laterally and forward towards the hypoglossal canal. The hypoglossal nerve exits the skull through the hypoglossal canal located in the occipital bone. Then start the external cranial course when it leaves the skull through the hypoglossal canal. Once the nerve exits through the hypoglossal canal, it enters the neck. Then there is descending pathway of the hypoglossal nerve. As after emerging from the canal, the hypoglossal nerve descends briefly between the internal carotid artery and internal jugular vein. It passes deep to the posterior belly of digastric muscle and stylohyoid muscle. Then there is looping course of the hypoglossal nerve, that is when nerves form a loop around the occipital artery. It crosses laterally over the external carotid artery near its origin. Then there is horizontal course of the hypoglossal nerve. This is when nerves move forward, running deep to the posterior belly of digastric and mylohyoid muscle. It then passes above the hyoid bone to reach the tongue. The further course of the hypoglossal nerve includes distribution and branches, as it has motor branches that supply all intrinsic muscles of tongue that are responsible for fine movement and shaping of the tongue. It supplies all extrinsic muscles of tongue too. That includes genioglottal muscle that cause protrusion and depression of the tongue, hypoglossal muscle that depress and retract the tongue, styloglossal muscle that elevate and retract the tongue. Exception is palatoglossal muscle that is supplied by vagus nerve, that is 10th cranial nerve. Then it has communicating branches of the hypoglossal nerve that include cervical plexus that are the some fiber that travel with the hypoglossal nerve to innervate geniohyoid muscle, thyrohyoid muscle, and the ansa cervicalis also branches off through the connection with the hypoglossal nerve to supply the infrahyoid strap muscles. Summary. The motor signal originate in the hypoglossal nucleus in the medulla. Then nerve fiber emerge as a multiple rootlet from the anterior lateral sulcus of the medulla. These fibers converge and exit the cranial cavity through the hypoglossal canal, and then nerve descend between internal carotid artery and internal jugular vein, then loops around the occipital artery. It runs forward across the external carotid artery to enter the tongue, that's supplying both intrinsic and extrinsic muscles. C1 fibers traveling with 12 cranial nerve provide additional nervation to geniohyoid and thyrohyoid muscle. Relations of hypoglossal nerve. It is closely related to major neck vessels that include external and internal carotid arteries and internal jugular vein. It lies deep to posterior belly of digastric and stylohyoid muscle. It crosses over the lingual artery as it enters the tongue. Conclusion of this lecture video. Hypoglossal nerve is purely motor nerve with relatively straightforward but clinically significant pathway. It arises from the hypoglossal nucleus that exits the medulla and traverses the hypoglossal canal and supplies nearly all muscles of the tongue, enabling articulation, swallowing, and precise tongue movements. Its anatomical relation with cervical structure and its connection with cervical plexus fiber are essential for understanding neck and tongue neuroanatomy. And this was all about hypoglossal nerve pathway. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.